Hello, I'm John Foster, and I'm a medical doctor who does Social Security exams. And the title of today's video is What is Hypochondriasis? I was prompted to do this because apparently some doctors doing these exams are labeling everyone with functional illness as malingering. As usual, everything I say reflects my own opinions based on my own experience and learning, and not the opinions of the Social Security Administration or any other medical body. Now, first I'd like to talk about what is functional illness. Functional illness is physical symptoms and/or signs that are produced by mental processes rather than physical processes. Note, the motivation is not described. In general, there are 4 types of people who present with functional illness for disability exams. The most common, in my experience, are people with hypochondriasis. The next most common, or perhaps equal to hypochondriasis, is what I call symptom exaggeration. Less common is malingering, and the rarest of all is psychosis. So before I talk about mental illness, I need to define mental health. So mental health is, number 1, the ability to achieve Maslow's hierarchy of needs. If one's mental processes are so deranged or confused that one cannot obtain food, water, and shelter, I think anyone would agree that the person has serious mental illness. Other factors are regulation of the emotions. Note that that doesn't mean having no emotions or having only mild emotions. There are certain circumstances, such as the birth of a child, when extreme elation is appropriate, and other circumstances, such as the death of a parent, when extreme sorrow is appropriate. However, extreme and persistent sorrow because one lost a dollar bill would not be appropriate. Mental health includes the abilities to have satisfactory relationships, which will usually include relationships with one's family, one's partner, one's children if one has children, one's associates at work, and other people in the community. It includes the ability to both work and to play, and in most cases to procreate. Again, note that the absence of negative emotion, worry, and sorrow is not a component of mental health. Folks who are mentally healthy will worry when worry is appropriate and will be sorrowful when sorrow is appropriate. So what is mental illness? Well, I think that mental illness reflects mental conditions that interfere with achieving Maslow's hierarchy of needs, interfere with the ability to work, play, and procreate, produce generally negative emotion, which may be in the self, in others, or in both, and which is persistent. Note that mental illness may not necessarily produce negative emotion in the self. Folks who produce negative emotion in others while feeling fine in themselves are generally folks with personality disorders. So what is hypochondriasis? Hypochondriasis is the conviction that one is seriously ill, and this conviction and illness assume great importance in the patient's life, sometimes being the center of their existence. And these illnesses that the patient believes they have do not actually exist in physical form. What are the characteristics of people with hypochondriasis? Well, they're highly sensitive to negative emotion, which is anxiety and depression, or worry and sorrow. As a general rule, women are more sensitive to negative emotion than men, and hypochondriasis is more common in females than males. That doesn't mean that there are no males with hypochondriasis. There certainly are. It just means that more than 50% of the patients you see with hypochondriasis are female. These patients are convinced that they're sick, sometimes with common diseases, but quite frequently with rare diseases. They are obsessed with the illness. It may become the entire focus of their lives. They may research it on the internet. They often go from doctor to doctor to doctor. They seek a medical diagnosis to validate their conviction that they're ill, and they're overjoyed if they receive one and will never relinquish it. If one tries to convince them that they are not ill, they will become very angry because that threatens their whole existence. They often participate in online discussion groups for whatever illness they believe that they have, and often these online discussion groups have a high percentage of folks with hypochondriasis. If they can afford it, they may travel far and wide seeking diagnoses and cures for their illness. For example, a long time ago, I read in the Canadian Medical Association journal an article by one of my teachers during residency. They had encountered a patient who was convinced they had gastrointestinal disease, when in fact there was no physical evidence of such a disease. They had visited every single gastroenterologist in Canada, hoping to find the answer. That took a lot of time, money, and dedication. Canada is a big country. People with hypochondriasis often withdraw from all aspects of life except that of their illness. They may stop working, they may stop helping in the home, they may stop participating in community activities. Patients with hypochondriasis are at risk from the medical profession, and there are two major risks. The first is over-medication. Doctors tend to write all sorts of prescriptions, hoping that they will assist these patients, and of course, none of them do. But the patient may continue taking 15, 20, 25 different medications. Whenever somebody takes that many medications, there are bound to be adverse effects. The second risk is unnecessary surgery. These patients may be operated on for imaginary illnesses, and of course, surgery doesn't relieve their mental illness. They may crave surgery, become surgery addicts. I saw a patient once in a Social Security disability exam who had low back pain that I believed was mostly functional. This patient had had 4 surgeries on their back, and they told me that none of them had helped a bit. Yet they described with delight their upcoming back surgery, which they were going to have the next month. I asked them, if 3 surgeries didn't help, why do you think a 4th will? And they had no real answer. For my surgical colleagues, I advise, think twice, think 3 times, think 4 times before operating on a patient you believe is hypochondriacal. especially if there are no objective signs of physical disease, and more importantly, if the only manifestation of the disease is pain. Operating for pain alone is very risky. That doesn't mean that patients should never be operated on for pain alone. I have a friend who is very athletic who developed severe low back pain and couldn't participate in his normal activities. He had low back surgery. The pain was completely relieved, and he was overjoyed that he could resume his athletic life. But in this case, the patient clearly was motivated to not be ill. Patients with hypochondriasis may be on the borderline personality disorder spectrum, and this may be reflected in their relationship with physicians. They may calumniate the physicians they've seen in the past and idolize the physician they're seeing in the present. That doctor is the greatest, the only person who ever listened to them, etc. Be assured, if you're that idolized physician, sooner or later you will be one of the group of terrible physicians who couldn't do anything for them when the patient moves on to the next physician. Now, the delineation between hypochondriasis, which is considered to be a neurosis, and psychosis is often blurred. Nobody would feel that the patient I saw with Capgras syndrome, the young woman who believed that 3 months prior to seeing me she had completely stopped breathing, was hypochondriacal. She was clearly having her first episode of psychosis. However, here's one that blurs the lines. Again, a long time ago, I had a woman in her 60s come to the clinic with the chief complaint being that she thought she was pregnant. The nurses told me that this woman came to the clinic every 2 or 3 months, convinced that she was pregnant, and wanted the doctor to do a pregnancy test. At this time, home pregnancy tests were not available. They told me that if I would just do a pregnancy test and tell her it was negative, the woman would be happy and leave. And that's exactly what happened. There's a name for that. It's psychosis, false pregnancy. And an interesting fact is, I had a dog that had repeated psychosis. This dog, which I had when I was a teenager, had several litters of puppies, and then we had her sterilized. After sterilization, she would have false pregnancies where she would make a nest and guard it, and that could last for a month or 2. The woman with psychosis did not seem mentally ill in any other way. She wasn't hallucinating, and the only delusion was the delusion of pregnancy. She didn't even seem to have a great deal of negative emotion. So, to summarize, people with hypochondriasis are obsessed with their body and convinced that they have serious or very unpleasant disease, and that conviction is virtually unshakable. They're high in negative emotion, and females predominate over males. They're at risk for unnecessary medication and surgery whenever they encounter a medical professional. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.